Good morning. Okay, so welcome to session 2. So this morning in session 1, we very adequately addressed the issue of why we need to do this. And interestingly enough, I think it's clear from the turnout that we have here today that it's very important, this particular topic. So now we're going to address the how, and on behalf of myself and Niklas Hedberg, the co-chairs of this session, I welcome you to this session. So this session is all about how scientific information can be incorporated into a common development track. But when I considered this question last night, I actually felt that perhaps we needed to reframe this a little into how can we really optimize evidence generation, because actually we're trying to find the most efficient way to generate evidence across the life cycle of the products. So I actually think there are some areas, and it came out this morning, where parameters can be aligned across the different stakeholders, and there may be other areas that may not be aligned. So I think before I hand over to the first presenter today, I'd like to think about 3 questions that we can sort of have in our minds as we listen to the presentations. Question 1, I think, what are the potential areas for alignment, and what are the areas where it's difficult to align the parameters? And I think this is important because actually in some cases forcing alignment may actually close down some of the strategic options that drug developers may need to keep in mind when they're designing phase 3 trial programs. I think number 2, and this is important, what is the right balance between the perfect experiment and the ideal real-world scenarios? And I think it's really clear that actually there seems to be some sort of tension between broadening out trials to make them more pragmatic, and actually should we be doing that, or should we actually be keeping the trials really tightly designed and the sort of the tight experiment, and then working out ways that we can expand that out to real-world practice? And I think that's an important point we should think about. And I think within that, there's the whole pre- and post-authorization evidence development question. And I think the third point is, what are the sort of mechanisms that can help drug developers make sense of the various perspectives that we see across stakeholders? How can we improve our understanding of how to integrate these different perspectives? And I think this might be rooted in really a better understanding of the benefit-risk frameworks that different stakeholders are using to drive their decision-making. And I know this is an area of interest to regulators, but I think in the area of HTA, this is very interesting as well. And of course, how do we make sure that we get the patient perspective at the heart of that decision-making as well?